So having a counsel as a little kid is not acceptable from a stigmatic standpoint, right? No.
What do you think? உங்களுக்கு என்ன ஏஜ் குரூப்ல உங்களுக்கு பேஷண்ட் வராங்க, எனக்கு மட்டும் ஏன் வரக்கூடாதுன்னு நினைக்கிறீங்க?
No. I wish I'm saying that every adult. So
Yeah.
my point is that every adult needs a therapist.
Yes.
Okay, that is because I deal with a lot of gut patients,
Yeah.
and gut problem starts with the brain.
Yeah. Gut is the second
Brain. And then so I always in my New Me program we have 10 psychologists. Because I strongly believe that only
That's
if you
important.
then the gut cannot be solved. But for the kid, at what point of time that the parent should be okay, so maybe this kid needs a support. Okay, that is a stigma that is there in Indian
Yeah. Even now there are, see, sometimes when
I'm not sure how you are getting patients, to be honest.
what are you doing?
No, because of the stigma.
No, actually I should say, doctor, or 12 years back when I so many years back when I started work, 15 years back when I started work, they never used to come.
Yeah.
Marital counseling க்கு ரெண்டு பேர் வந்து உட்கார்ந்திருப்பாங்க. எங்க கொண்டாந்து நிறுத்திருக்க பாத்தியா? They look at me. ஐயோ, it's okay, we can work this together. Yeah. And then there are
They thought it was சொல்றதெல்லாம் உண்மை.
போகக்கூடாத ஒரு இடத்துக்கு வந்துட்ட மாதிரி. அப்படிதான். I have to tell this here.
You also look like Lakshmi Ramakrishnan.
உங்களோட யாயா உங்களோட
Even he also thinks that you Lakshmi Ramakrishnan.
Yeah, அந்த மாதிரி கேஸ்லாமும் நிறைய வரும். See, actually when your patients see you in the mall or at the park or at the beach, they say, no, hi, he's our gut doctor.
Correct.
And they introduce, no? Yes. For us, they will not do like that. Will anybody say, hey, this is Dr. Sharanya, she's a psychologist, I have a mental problem? They will not say. They will only, so I'll also say, hi, this is my friend. This is my student. இப்படின்னு சொல்லிட்டு நான் விட்டுடுவேன். They will not. It's still there in everywhere, not just India. Even abroad, it is there. I have a lot of patients in Dubai. So recently when I went, they all came and met me. They said, we are going and meeting a friend. I am not psychologist. They don't have any mental health problem. See, that's a problem with us. It's still a problem. But I think this current teenage generation, in their Netflix series, these young girls go to a counselor to talk about friendship. So for them, it's normal. They are comfortable. They come to me. The problem is with 21 years and above who don't understand this. Correct. So in every session, I ensure the first 10 minutes I explain to them, நீங்க பைத்தியமும் இல்ல, நான் பைத்தியக்கார டாக்டரும் இல்ல, நான் சைக்கியாட்ரிஸ்ட் இல்ல.
So you explain.
What is the difference between a psychologist and a psychiatrist? What do they do? What do I do? How I can help you? You are not a psychiatric patient. Don't label you that. So I am here to make you understand that you have to be happy, healthy, and you have to study well. That's all. And I will maintain confidentiality. I am not a channel to absorb information from you and throw to your mother. I am not your mother's adiyal. Some parents do that, doctor. They come and say, they're not opening their mouth. Why don't you ask and tell me? What do you think I am? No, that's not allowed. Yeah, we don't do that. We don't share all the information that I get from the child update to the mother. No, we don't do that. So now children understand. But whether they understand or not, I take that first 5-10 minutes to explain why they're here, who I am, what I can do with them. And that actually pulls them into a very good comfort zone. Yeah, and by answering your question, by referrals, I get a lot of patients. By reviews, Google reviews, I get a lot of patients. No,
so it's opening up.
Yeah, it is.
They're opening up.
Yeah, it is.
But let's say...
But I should say, I have one more problem. At home only, they will put all their symptoms in ChatGPT. They will come to me. They will sit and say, Doctor, I think I have ADHD. Can you help me?
The kids.
Yeah. So I say, நான் தான் கண்டுபிடிக்கணும். Okay? நான் தானே டாக்டர், நான் தான் கண்டுபிடிக்கணும், அதுக்கப்புறம் நான் தான். So to make them unlearn and then make them relearn is also one task for me. No, the older patients even worse, doctor. They will come to me in the
older is what time? What year?
30s.
30.
Okay.
But you are a child psychologist.
Yeah. No, not necessarily. I'm an educational psychologist.
Okay.
I have marital cases that come
I
to
see.
me. Yes, some senior citizens with screen addiction, they also come to me. So these marital cases, the couple will come and she'll say, I want to talk to you alone. And then the husband's waiting outside. She'll say, he has all traits of narcissism. He has narcissistic personality disorder and requires 16 sessions of CBT for this. Or do you try dialectic behavior therapy, doctor?
They're asking you.
Yeah, where did you find all this, ma? ChatGPT. See, don't go to the internet for your mental health issues. Please don't go. I don't say ChatGPT, Perplexity, leave alone AI. Don't even go to Google. Please come to us. Not because I want to earn, but at least I will be able to help you properly. Because there is there's a lot of wrong diagnosis that's happening. They simply think, see, sad is different, depression is different. Sad is a symptom of depression, isn't it? If you scold your child and your child is crying for 2 days, the child is sad. There are parents who will get my appointment and say, full depression, doctor. 2 நாளா டிப்ரெஷன்லே இருக்கான். 2 நாள்ல டிப்ரெஷன் வராதுங்க. டிப்ரெஷன்ங்கிறது கொஞ்சம் வேற.
Takes a lot of time.
Yeah, it takes a lot of time. Right. So, it's now become fancy to use such words. ஒரு காலத்துல எங்களோட we could not explain our terms to anybody. Nobody was ready to accept what is depression, what is anxiety. Today, to say don't use these words is a task for us. Every single person, we have stress. Every single person has depression. Every single person has anxiety. OCD. Anybody uses this word unnecessarily, I'm going to bring on cricket bat only and beat everybody. Don't see, there are men who say, my wife is always cleaning the house. Full OCD. Cleaning the house not OCD. Why you're thinking like that? So it's now become a fashion to use psychological disorders as terms in your everyday life. You understand? Chumma pora pokla Chuma say 1 or 2 words. No, that's not okay. For in my profession, that is a big challenge today, to make them unlearn. For me to convince them that they don't have OCD is taking 1/2 an hour. What a waste of time. Why should you go to the internet and see? There are
But how are the kids coming to you? They're coming to you by themselves, or the parents are?
Now I should say 50-50.
Is that right?
Yes. Now I should say it's 50-50. They have problems with their friends. They see me on the internet and they say, we want to go and talk with her. Can you take us? Because nobody will understand us. She will understand us. So a lot of children are coming like that.
But as a parent, when should we say, okay, so I think he needs therapy or counselor?
If he is asking for it, please take him.
No, but if he's not asking, how do we...
So what are the symptoms you have to look for? One thing. If this child has suddenly lost interest in something, was liking music, but now suddenly does not like music. Used to study well, suddenly, academic decline. And then not sleeping properly. Losing all friends in a month and isolating. Refusing to go to school refusal. Isolating inside a room, social isolation. And then they say, I don't want to see these friends who come home. Why these people are coming home on a Sunday? I have only one Sunday to sit and watch TV. So basically isolating from everybody, not talking enough, not eating properly at all for a long time. See, sometimes bullying leads to eating disorders. That's something that we cannot ignore at all. So these signs we cannot ignore in a child. We have to keep looking for these signs. Main problems arrive when parents ignore these signs for a long time.